Hello, my name is Corinne Coe. I'm a psychologist in private practice in Brisbane, Australia. I wanted to do this video just to explain to sufferers what the main contributing factors in the development of anxiety, the symptoms, common symptoms experienced, and the most effective treatment that I have found effective in treating people for the last 20 years. So when it comes to symptoms, the main common symptoms experienced are palpitations, racing heart, dizziness, nausea, tight chest, tingling in your arms and legs, and shakiness. Now, everyone experiences different symptoms, and while those ones are the most commonly experienced symptoms, most individuals would experience other symptoms in addition to those, as well as different intensity levels of anxiety. The other thing that you need to also understand is that there's two parts in treating anxiety. So the first part is in learning to manage your symptoms by building your confidence in being able to control your symptoms. The second part is actually addressing the cause. And one of the causal factors is fear. So when you actually experience fear, if it's a real fear, like a real life-threatening situation, that means it's an actual situation where you're running away, you're in danger, or you're having to fight to actually deal with a real serious situation. What happens is that your brain actually releases adrenaline, and that adrenaline is meant to help you to escape and to fight and to deal with the situation in a very proactive and effective manner. So it is designed to actually help you rather than hinder you. Now, one of the things that happens when adrenaline is released in your system is that every single muscle in your body, from smallest muscles to larger muscles, all become tense. And if there was a life-threatening situation, like a real situation, the severity of the symptoms that you normally are experiencing, you would not be experiencing as intensely. The reason for that is because when you're actually running away from a situation, you're actually dispensing and using that adrenaline up to escape. Now, at the end of that situation, you will feel extremely exhausted, which is what adrenaline does. So one of the problems is that when people actually experience anxiety attacks, a lot of the times it's not for a real threat. It's actually for a irrational fear. And that irrational fear might be more like in terms of what if scenarios, the worst case scenario, catastrophic thinking. So when that happens, unfortunately, what people are doing is actually pressing the panic button before a situation happens, in anticipation for a situation that probably never happens. Obviously, if it's irrational, it doesn't happen. So what happens is that your brain has already released that adrenaline, but it's not being used. So when that adrenaline, that turbo fuel gets released, it's just going to sit in your system, and it's going to just dispense, not because you're running away from the situation or dealing with it, but it's going to dispense in time. And once that time elapses, then what happens is that the adrenaline reduces, and as the adrenaline reduces, so does your symptoms. But unfortunately, because it's an irrational fear and you're not using up that adrenaline, it is actually going to cause you to experience the symptoms that are very uncomfortable and very frightening for a lot of people. Now, the two main causes for anxiety disorders are the main common ones. While there are other causes, the two main common ones are very critically low self-esteem. So if you've had a very dysfunctional background, or if you've had some negative experiences that have actually affected the development of a healthy self-esteem, that means that you don't feel competent enough to deal with a situation, or you might sort of like have lived your life too much within your comfort zone, and as a result haven't had any opportunities to actually develop skills, coping skills, or even to develop, I guess, confidence in being able to manage and deal with situations. So that is one of the main common ones. The other one is catastrophic thinking, so unhealthy thinking patterns, worrying, excessive worrying, worrying about the worst case scenario. So sometimes that can actually be a habit that you develop, and it might even be just from, seeing people in the past, maybe mimicking and observing maybe a parent who's actually worried excessively, or it might even be that you've actually developed that along the way. But these are the two main common causes. So one of the things that in treating anxiety, there's, like I said earlier, there's two types, two stages. So you've got managing the symptoms and building your confidence in managing those, so keeping them stable. And there's also in addressing the cause, and the cause will be to address the irrational fear. Now, to address the irrational fear, unfortunately, the most effective way, you have to go and get some therapy to do that. It isn't, going to be easy to do it without going and seeing a therapist. The managing your symptoms, though, that's something that you can actually do by controlling your breathing. So when you are fearful, what is normally happens is that you might sort of like be breathing very shallow and fast, and sometimes you might even hold your breath. So when you actually hold your breath and breathing shallow, your brain actually then thinks that there's something that needs to be dealt with. So what it actually does, that's the signal that your brain needs to release adrenaline. So it will actually open the tap of adrenaline, and it will actually close the tap on relaxing hormones. Now, when you actually breathe deep and slow, obviously it has the opposite effect. So the signal that your brain would be getting is, okay, there's no problem, there's no need to run away from anything or fight something, I just want to relax. So what it will actually do is it will turn off the tap of adrenaline and open that tap, the valve, for relaxing hormones, which will actually saturate every single muscle in your body, which will actually reduce a lot of the tension that you would normally experience during anxiety. So one of the reasons so that's something that you have to do when it comes to managing symptoms, is to actually control your breathing. So if you're someone who actually suffers anxiety, in generalized anxiety, which is pretty much all day, most days, then I would actually be starting off by controlling your breathing, doing deep, slow breathing from the first time you wake up in the morning right to the time you go to bed, and just starting to learn to manage your breathing. And once you actually are able to control your symptoms in a safe environment like your home, then you'll start to build your confidence. And once you actually build your confidence in managing those symptoms, then you can actually then go to maybe some therapy and start to address the causal factor, which in a lot of cases is self-esteem issues, as I've mentioned earlier, or unhealthy thinking patterns and catastrophic thinking. So one of the things I've done is I have actually written a book on a self-help book, which is called Heal Your Mind, Heal Your Life. It is available on Amazon, so amazon.com or amazon.com.au. It's also available on my website, www.corinnecoe.com.au. The book is actually has a first part of the book is explaining in more detail what I've just explained in this video about anxiety. The second part of it, or 3/4 of the book, is actually a book designed using the program that I have always used in therapy to treat people from anxiety. And it actually has exercises and homework to help people to start develop a healthy self-esteem and coping skills. And with the, I do also provide Skype sessions internationally as well as within Australia. So if you're interested in some Skype sessions, just message me on my Facebook page called Heal Your Mind, Heal Your Life. And I'm happy to answer any questions that you might want to ask. The other, I will actually be doing another video about depression. So stay tuned. Thank you for listening. I hope it's been quite helpful. I would really appreciate any comments that you might have and feedback. Thank you.